Dr. Judy Lubin joins me now. She's a sociologist and founder and president of the Center for Urban and Racial Equity. That center works with organizations to promote equity in policy and institutions, CURE, as it is for short. Dr. Lubin, thank you so much for joining us. CURE worked to advance equity in St. Paul for, I think you said, the better part of last year. Can you explain what the organization did there and your reaction to seeing that video of George Floyd's death at the hands of police just nearby?
Thanks for having me, Lauren. We worked with a client organization in St. Paul, Twin Cities area, where we're seeing the eruption of an uprising, really, to the systemic racism and abuse that we know continues to exist unabated in policing in this country. And so with our partner organizations that we worked with in St. Paul, we really do a top to bottom analysis of the organization's culture, practices, hiring policies, and then walk them through an action planning process to really do what we call is undoing racism, really looking at systemically all of their processes and practices on a day-to-day basis to ensure that people of color have a fair chance to advance within their organization, but importantly, that they are serving the community in St. Paul in a way that is respectful and that shifts power to those of which they serve.
And so just having been there, your organization working there, you said for the better part of the year, seeing that video of George Floyd dying, what was your reaction, the reaction of other people at CURE?
We were heartbroken, like so many other people around the country and around the world, right? Heartbroken to see someone lose their life at the hand of police. This was completely preventable. This is not new. This has been going on for decades, for generations. There's been efforts to try and to get police to de-escalate, to respect our communities. It's this huge wake-up call that we have to accelerate our efforts towards racial justice in this country. What we've been doing has not been enough.
The protests also highlight other disparities in American society, not just when it comes to policing. We also see vast disparities in healthcare, especially highlighted by this COVID-19 pandemic. And given your extensive public health experience, can you explain for us the disparities in healthcare that African Americans face, not only during the pandemic, but just in general?
So Black people in this country have never really had a fair chance to be healthy. We have generations of policy that have restricted our access to health care. And so historically, we have had limited access to health care, limited access to quality health care. We know that even when Black patients have comparable health insurance to white patients, we receive inadequate care and often are denied the same level of treatment as white patients. And so there's healthcare bias in the system that we need to root out. We saw with COVID-19 that where the testing locations were placed were predominantly in the early days of the pandemic were placed in white, wealthy neighborhoods, as opposed to communities of color, as opposed to low-income communities. We also saw a number of reports, and the data is now starting to bear out, that there were disparities in terms of Black people being disproportionately turned away when going to seek care for COVID-19 and going to get tested. And so these are long-standing systemic issues that we need to address in every institution, including healthcare. And COVID-19 has really laid bare these pre-existing conditions that we know have existed for generations, but now is the time. Now is the time. This moment is asking us for real substantial change, and that we can't take our eyes off the ball.
And obviously, we see protests across the country, even the world, and they're important. They can raise awareness, spread a message, demand change. What other steps can we as a society take to end racism and discrimination?
So this has to happen both on an individual level as well as an organizational and institutional level. And so what we do is we go in and we work with organizations to really be self-reflective, look internally, and as to how you have absorbed the messages of Black inferiority, of the messages of racism that says that we have a hierarchy of human value. And we have to challenge ourselves to not only, do that self-reflective work, but actually to take action to challenge it. So when we see racism showing up, we actually speak up. We work within our organizations. We talk to our family. We talk to our friends. We connect with community organizations that are working on these issues, and really, commit to this work. It's long-term work. This is 400 years of racial oppression that we're trying to dismantle. And so we have to be committed to it. It may take us 400 years, but we have to commit to it and continue to fight and get involved and stay involved.
Dr. Judy Lubin, thank you so much for joining us today and for your insight. I really appreciate it.
Thank you.